consultant surgeon. You may feel able to do everything that you were doing before the operation. However, a patient's recovery is individual, and in some circumstances, your normal activities may need to be adapted. You may continue to experience some chest discomfort or skin sensitivity for a period of time. This may be aggravated by strenuous activity, especially if it's been resumed too soon after your operation. If you're experiencing any ongoing problems, please discuss them with your GP, your consultant surgeon, or lung nurse specialist. Specific information once you're at home. Arm exercises. It's important to maintain the range of movement in your shoulder following surgery as it may be stiff. During the first few weeks after your operation, you should continue to stretch your arm above your head as you were shown in the hospital by the physiotherapist. You may experience a restriction towards the end of the movement. This is normal and will reduce with practice. These exercises should be continued for the first 4 weeks after the operation. Eating and drinking. Initially your appetite may be poor, so try to drink and eat a little when you can, as this helps with wound healing. The dietitian will offer nutritional support if required. Constipation. Indigestion and constipation are also common, as your normal functions may slow down during surgery. Some patients suffer from nausea as a result of the anaesthetic and the drugs. Do ensure that you inform the nursing staff should this happen to you, as it can be treated. Mobilisation. We will want you to be up and about quite quickly, depending on what type of operation you have had. You should be able to walk around your bed within 2 to 3 days. The physiotherapists and nurses will help you carry out your exercises regularly. Exercise is encouraged to help prevent stiffness, bed sores and constipation. It will also help your lung function. In addition to your support stockings, which you will be given a small injection of an anticoagulant, which is medication to help the blood flow freely and prevent clots from forming. You will be shown how to move yourself without putting strain on your wound. However, if you are unable to move yourself, the nurses will assist you and may use a lifting aid such as a hoist. Wound. Most patients having chest surgery have a wound that will extend from just under your shoulder blade around the side of your chest to under your armpit. The nurses will check your wound regularly until you leave hospital. It's important to report if there's any redness, pain or leakage from the wound, so that this can be treated appropriately. You may have stitches in your wound that will need removing 7 to 10 days after your operation. If you are discharged beforehand, the ward nurse will arrange for a district nurse to remove them at home. If your job involves heavy manual work or is stressful, a longer period of recovery is advised. You should allow at least 3 months following surgery before returning to this type of employment. If it's possible, you should resume your employment on a part-time basis at first, either working shorter days or shorter weeks. You should discuss this option with your employer. Moods and emotions. Immediately after the operation, you may have had days when your spirits were low and you felt depressed. These feelings are known as the post-op blues, and many patients recovering from the operation get them. Patients can feel unusually emotional and irritable during the first 6 weeks after the operation. This can often happen without prior warning, and you may feel tearful, anxious, very depressed or resentful. These feelings are common after the operation and should not be a cause for concern to you or your family. They generally resolve spontaneously. Remember that you and your family will be affected by these feelings, and it's important that you discuss what you're experiencing. Family members will have a tendency to become overprotective when you first go home. Do not resent this. Be patient with them. Remember, it also took you time to realise that you could do things for yourself. Listening to your family and informing them of how you're feeling will ease these feelings. If you're feeling unduly depressed or have continuing problems with loss of memory or concentration, consult your general practitioner. Rest, sleep and relaxation. During the first few weeks at home, you will find you tire easily, so adequate rest is important, as exercising for your recovery. Have a rest in the afternoon for an hour and make sure that your friends and relatives are aware of when your rest periods are to reduce disturbance. If you tire during a particular activity, such as climbing stairs, sit down and rest. Try and have a good 8 to 10 hours sleep each night. This may be difficult at first because your normal sleeping pattern will have been disturbed. It may take you a week or two to settle back into your normal sleeping routine. In addition, you may find that your normal sleeping position is not comfortable. In the early days after your operation, due to wound soreness, it's important to continue taking your pain control regularly at night to aid sleeping. Gardening. Light gardening such as weeding may be done 4 to 6 weeks after your discharge. Mowing the lawn should not be considered until you are fully recovered. Bathing. Do not be afraid to get your wounds wet. Showering or bathing will keep your wound clean and encourage healing. However, we would advise for 6 weeks following your surgery, you should not soak for long periods in the bath. If you have the choice of a shower or a bath, Take a shower instead of a bath for the first 2 weeks following your surgery. For your safety, we would advise that you do not attempt to have a bath when you are alone in the house for the first 2 to 3 weeks following your surgery. If you do take a bath, please note the following. Empty the water out of the bath before you get out. Place a non-slip mat or towel in the bath before attempting to stand up. If possible, get assistance to get out of the bath. Alcohol. Alcohol may be taken in moderation after discharge from hospital, but you should ask your nurse or pharmacist for information about alcohol consumption with your particular medication. If you need or want to reduce your alcohol intake, please discuss this with your GP. Smoking. To help make sure that smoking remains a past activity, you may find the following points helpful. Keep a list of reasons for stopping smoking and refer to it regularly. Contact the Smoking Cessation Advisor on 0151 600 2455 for practical help to help you stop smoking or for you to continue not to smoke. Find other ways to relax, for example talking with friends, listening to music or taking up a new hobby. Driving. Do not drive following discharge from hospital until you have been reviewed at your outpatient appointment and advised by your surgeon that it is safe. As a result of the wound and the healing process, muscular strength and general agility is reduced, and sudden movements can bring on pain. It is therefore essential that you do not drive a motor vehicle until the healing process is sufficiently advanced. When driving a car or as a passenger, you are not exempt from wearing a seatbelt. Sexual activity. Many patients who have undergone thoracic surgery experience anxiety about resuming sexual relationships. It's quite safe to have sex and or sexual stimulation after the operation whenever you feel ready for it. However, we generally advise you to wait between 2 to 4 weeks to allow your body and wounds time to recover. Choose an ideal time when you feel relaxed, comfortable and in familiar surroundings. Avoid times when you feel tired, tense or after a large meal. Do not expect too much of each other initially. It's unlikely you will do any damage to the surgery, but sensible measures should be taken to avoid extensive strain on the chest wound. Choose a position which is comfortable and does not restrict breathing and stress to your chest. Do not take your weight or your partner's weight on your arms. Do not attempt to be too energetic at first. Holidays and flying. Now the operation is over, you may wish to plan to take a holiday. A restful holiday in this country may be undertaken at any time, providing you're able to cope with the travelling. Holidays abroad should be deferred for at least 8 weeks after the operation. At your outpatient appointment, discuss your plans with the surgeon. Avoid strenuous holidays and extensive travelling at first. Cover the scars with complete sunblock when sunbathing in the first 6 months. It's also important to clarify your holiday insurance. Dietary advice. During convalescence, the food you eat plays an important part in the healing process. It's not unusual for your appetite to be poor in the early weeks following surgery. Regaining your appetite fully may be a gradual process. You may have experienced some weight loss prior to surgery. This may have happened due to your medical condition and anxiety experienced at this time. Any condition where the breathing is difficult causes the body to use up more energy in the effort to breathe. Therefore, it is very important that your nutrition after surgery is aimed at ensuring you have enough to eat and also to build yourself up if you've lost weight. If your appetite is small, aim to have 5 or 6 small meals or snacks during the day. It's easier to eat more this way. Ensure you use full cream milk and generally low-fat diet-type foods. Enjoy a wide variety of different foods and eat more of the things you know you like. You may have been prescribed a high-protein supplement drink as advised by a dietitian or GP. Continue with these as long as your appetite remains poor or until you've regained your lost weight. If you have some weight to lose, do not cut down on your food intake at this stage. After a period of 3 months, you should be resuming your normal eating pattern. It is at this time you should consider healthy eating. However, if weight loss continues to be an issue for you, please consult your GP and disregard the following information. Advice regarding healthy eating. There are 3 most important aspects of a healthy diet, which have been shown to help maintain good health. Eating more oily fish. Oily fish contains oils known as omega-3 fatty acids. There is strong evidence to show that these help to protect your heart. Try to eat 2 to 3 large portions each week. Oily fish include sardines, mackerel, herring, kippers, tuna, trout, pilchards and salmon. This includes canned fish as well as fresh or frozen fish. Eat more fruit and vegetables. Fruit and vegetables provide vitamins and minerals which help protect us against heart disease. Try to have at least 5 portions of fruit and vegetables each day. An example of portions: 1 apple, an orange, a pear or a banana, 1 large slice of melon or pineapple or half a mango, 2 tablespoons of vegetables. This includes raw, cooked, frozen or canned, 1 small bowl of salad, 1 glass of unsweetened fruit juice. Eat less fat. Fat is an important part of our diet because it gives us energy and vitamins. However, eating too much fat can increase the risk of heart disease and lead to weight gain. How can we eat less fat? Grill, bake or steam food instead of frying it. Use skimmed or semi-skimmed milk. Spread unsaturated margarine or low-fat spread thinly. Cut the fat off before cooking. Use a small amount of oil in cooking. Changing to a healthy diet needn't be difficult or more expensive. Above all, it's important to enjoy your food. Outpatient appointment. Your surgery will see you approximately 6 to 8 weeks after your operation as an outpatient. This may be at the Liverpool Heart and Chest Hospital or at your local hospital. This appointment may be given to you prior to your discharge or sent through the post. Please ask your ward nurse if you're unsure about the details. Further treatment. Occasionally, patients who have undergone surgery for lung cancer may need to be referred to another specialist, an oncologist, for consideration of further treatment, for example radiotherapy or chemotherapy. If this is necessary, your surgeon will discuss this with you. Useful contact numbers and website addresses. There are a variety of different organisations working within the National Health Service who provide valuable information and support for patients. Listed below are a few contact details which may be of use to you. Lung nurse specialist. If you've been diagnosed with lung cancer, the lung nurse specialist is available to you and your family for support and information. You may have already met your local nurse. However, if you have not, you should be able to contact your lung nurse specialist via the switchboard at your local hospital. If you're not able to get these details, please call the lung nurse specialists at the Liverpool Heart and Chest Hospital on 0151 600 1182 and they will advise you of the details of your local nurse. Roy Castle Lung Foundation, a nationwide lung cancer patient support and information network, is available through the Roy Castle Lung Cancer Foundation. Services include a free national helpline that provides information on support groups in each area. There are several across the country. Telephone 0800 358 7200 to find out about your local group. The Liverpool Lung Cancer Patient Support Group is held monthly. For further information, telephone the lung specialist nurses at the Liverpool Heart and Chest Hospital on 0151 600 1182. Written information books are also available. Cancer Backup. Free phone 0808 800 1234. It provides advice and support for patients and their families following diagnosis of cancer. A range of free publications is available. Macmillan Cancer Support 0808 808 2020 supports and develops services for people with cancer and provides Macmillan nurses, doctors and cancer care. The British Lung Foundation 020 7688 5555 works throughout the UK to improve the prevention, diagnosis and treatment of all lung diseases. It can provide information and advice to patients and families affected by any lung disease. The North West Group can be contacted on 0151 224 778. There are many ways of finding out information. One of the most common ways is through the internet, and below are some suggested websites that contain a variety of information. If you do not have access to the internet at home, there are many local libraries and internet cafes that you may use. For further information, visit www.roycastle.org, www.cancerguide.org, www.nhsdirect.nhs.uk, www.backup.org.uk, www.cancerline.uk. Remember, there is no way of monitoring the quality of information you may receive on a website. If you're unsure of any information, please ask your hospital consultant, ward manager, general practitioner or specialist nurse. Specific information. It may be useful for you to have some of the details below filled in before you are discharged home for you and your family. Your ward nurse will help you if you're unsure of any of the details. You can then use this information should you require further information advice at home. Liverpool Heart and Chest Hospital NHS Trust 0151 228 1616. Your hospital record number, your named ward nurse, your consultant surgeon, your local hospital, the phone number, the consultant chest physician, the lung nurse specialist, your general practitioner, surgery and phone number. We hope this booklet has been helpful in answering some of your questions. Do not forget it is only a guide and every individual differs. If you require a copy of this leaflet in any other format or language, please contact the customer care team on 0151